Okay guys, for this final one, we'll be doing the mitral valve, which again, we can listen either at the fourth or fifth intercostal space on a male patient. Obviously again, for the female patient, we're just gonna listen a little bit above. So again, third intercostal space instead of the fourth or fifth intercostal space. So we'll demonstrate that here. So again, Juliet, do I have your permission?
Yes.
Okay. So again, normally the location for the mitral valve would be fourth or fifth intercostal space, mid-clavicular line. We're just gonna do the same thing, mid-clavicular line, but at the third intercostal space, okay? And for this, you can listen technically over the sports bra. If you know, normally we listen directly over skin. If there's some clothing in the way, that's fine for this. So again, we're making a modification, and we would have the two, or three other valves that would be easily auscultated as well. Okay, so we're gonna auscultate here. So again, angle of Louis, second rib, third intercostal space, and we're just going to listen right over. Okay. And hers sounds perfectly normal. So there's also another modified position you could also do, again, depending on the patient's anatomy. So Julie, can you lift up your arm here? You can also listen a little bit more laterally if you want. You're going to be kind of close to like the fifth, sixth intercostal space and pretty lateral. So you can have two different options for the mitral valve. I prefer you guys just to do the third intercostal space. It's just a little bit easier. Thank you, Julia. You can push hard down. Thank you.